So I think we're just going to talk a little bit about our impressions. This is the video we're making for the first reading, which is going to cover the first two chapters in the first part of the book. And I thought, we have our copies here. You can see we're so modern, we don't even have cover art for you. We're all reading on Kindles and tablets. So I thought we'd start off, this book kind of gets at the heart of a big question in our movement, which is why is the United States basically the only industrialized, developed country that doesn't have universal national health insurance? And there's a lot of ink that's been written and spilled on this question. And this is a book that has like a very interesting novel take on explaining that. And it involves the role of race and the politics of race in the United States, and the role of language and territorial politics around Quebec in Canada. But it's also just a way of sort of getting at these big questions of why do we have this American exceptionalism, and what do we have to do as a movement to win and to sort of catch up with the rest of the developed world. So I thought we'd start with, just talking personally about, before we even open this book, what were the reasons that we have heard and that we sort of got into this movement thinking were why the United States doesn't have, national health insurance. So you want to start with sort of the assumptions you came in with, like the explanations you had heard?
Sure. Well, I think the most common one, or the one that I've heard the most, is just that the U.S. has a more individualistic ethic and Canada is more collectivist. And it's sort of an explanation that I didn't think very critically about, just kind of accepted.
Mm-hmm. There should be some individualist joke thrown in there. Something like you're on your own for the rest of this interview. And the explanation I had heard, which is, I guess, a little more geeky, but the historical explanation I'd heard was that after World War II, when there was price controls, unions in the United States were becoming stronger, but they couldn't fight for higher wages because the government was actually setting wages and controlling them. So they fought for health benefits and other benefits. And so we sort of ended up by accident with this employer-based system that we then got stuck with.
I've heard that one too, actually.
Yeah, and in retrospect, it doesn't seem like a very satisfactory answer. I mean, these whole systems of power and money don't get built by accident. They don't get maintained and perpetuated by accident. That's sort of what we came in with, and we'd be interested to hear what you all sort of came into this book with as well on the forums. So I think how we're going to do, we're going to keep this brief. We're just going to talk about a couple things that each of us thought was really interesting about these first two sections, and that were insightful and that sort of fit with this frame, that this argument that Boychuk is making. And then we're going to talk about a couple of criticisms we had and things that we sort of stuck out at us as maybe being problematic or not fully fleshed out that we can give some more thought to. But what we're not probably going to do is get too much into the first chapter. Was really just like an overview, a summary of the whole book. And since we're going to be reading the whole book, I don't think we need to talk a lot about the summary, since each of those sections that he talks about we'll be able to get into more in depth later. But the second part is going in the really early period, 1910 to 1940, in both the United States and Canada. So do you want to kick it off, talk about one or two things that really stuck out to you and were interesting about either or both sides of that?
Sure. Well, one of the things, I think, going back to what I had just said about my assumptions going into the book, he kind of makes a good case about why political culture wasn't really, one of the main reasons that U.S. and Canada diverged. He talks about how the arguments, like for and against, were kind of the same in both the U.S. and Canada. And thinking about this narrative of the U.S. having a more individualist ethic, this is obviously something that has developed sort of since this time that we're reading right now in the book, 1910 to 1930 or something like that. And then he also makes another claim that, this is all actually based in that this individualistic ethic is really just like a cover for like a discussion about race, and how this myth that social programs shift, like basically take money from whites to undeserving blacks, is something that has sort of given rise to this individual ethic, and that it's actually rooted in this, in racism. And of course, it's not a new analysis, but it's really interesting to have it connected here, and especially in the specific case of healthcare.
Yeah, especially when he went into how universal healthcare is opposed in the provinces in Canada, like in British Columbia, and in the States, in the US, the opposition looked very similar, at least at that time period. It was doctors opposing it, some businesses. So yeah, he's kind of making the case that we were actually very similar culturally, politically at the time, and we had the same issues, and the divergence really came later. Anything else that stuck out to you, or
I'm gonna let you
should
go.
I jump in? Okay, all right. Some of the things that were really interesting to me was, growing up in the U.S., we all sort of know about Jim Crow more or less. I don't think we get a very good education growing up in the U.S., but we think of it as like a history of the South. But what really is coming out of this book is how Jim Crow shaped our national politics and shaped our national economy and our national social policy, and how there was these political coalitions that basically agreed to preserve segregation in the South, and that involved collaboration from politicians in the North, protecting a sharecropper economy in the South. And that just had a really profound effect on, and we're just talking about healthcare here, but it probably, he talks sort of about in passing, even about how it affected Social Security, retirement income security, things like unemployment, and how those policies were all shaped, even the ones that passed were shaped to protect this segregated economy in the South. So that really hit me, and it was interesting. The other thing
Can I say something else about what you just said?
Jump in.
No, just that, just when you were saying that, I remembered also that he talks about how the emphasis on states' rights, because with all these public programs, like you're talking about, like the states could control who got what, and that's and that's now why we have this big states' rights movement or whatever, and why it's so important for Southern states.
Right, and we still have that same states' rights argument, but it's been divorced from its origins, which was in racial subjugation in the South. And the other thing that kind of stuck out to me, especially when he was talking about the fights to win universal health care in certain states at the state level, much like today, the fight for universal health care in Canada and the US sort of went through waves of national levels and then went down to local levels of fights. But the political landscape he describes, he goes into depth in a couple of these cases, is really different from the one that we see today when we're trying to win universal health care. It was mostly physicians who were opposing universal health care back during this time period, 1910, 1940, very vigorously, and sort of, it seemed like there was a united front of physicians back then. There was some business opposition. There was even some organized labor opposition at the time, both in the US and in Canada. And the one thing you notice is missing is that there was no healthcare industry fighting any of this. There was no real organized health insurance industry or giant for-profit hospital interests. None of that really existed at the time. And today, that really is the groups that are primarily standing in the way of making healthcare universal. So the political landscape has really shifted dramatically, especially when we look at what's happened with physicians and organized labor. They've come such a long way from this time period. Anything else in terms of highlights, things that stuck out, or should we...
We can move on.
All right, let's flip to the things that we had sort of critical reactions to. All right, so you want to talk first about criticisms, things that sort of maybe need to be filled out more that you disagreed with?
Sure. One of the things that I thought I wasn't really clear on was his argument about why the states needed the federal government to buy in or something. I didn't really understand that argument. One area in which I thought that the argument was stronger was he talks about how industry was afraid that if they would be taxed to pay for this new insurance program, and industry in other territories or states in the U.S. They would just be competing unequally. And I think that it would have been good for him to mention that we live in a completely different, the political situation is completely different now. Everybody is paying for healthcare. The federal level, the state level, employers, patients, everyone's paying now, and it's not a matter of generating funds to pay for some program. It's a matter of actually figuring out where those funds are going to best be used. And so I don't know if his argument that the states would need federal buy-in, or rather, actually, that federal reform is the only way really to do this, really applies today, especially given that it actually occurred in Canada, the opposite. A state, or rather a province, passed it first, and then it became a federal law.
Yeah, no, and especially the story of British Columbia. And if you didn't make it to the end of the chapter, read to the end of the chapter, because the story of how close British Columbia came to passing universal health care very, very early on, way before Saskatchewan did it, is really super interesting. He goes into this whole history of how doctors fought it tooth and nail, how manufacturers fought it, and organized labor fought it. But it still was passed and almost implemented. And then the lesson he sort of takes away is it didn't pass because it needed federal funding or something. It's like, well, the whole story is about actually the political opposition, right? And there was no detail about why they needed federal support, and actually Saskatchewan didn't when they did it later. So there was also a couple of other things that struck me that were sort of missing from the book. One is there wasn't much discussion of how, the healthcare industry itself or the healthcare system had changed so much. I mean, the time period that they're talking about here, like 1910 to 1940, I mean, that's not like bleeding patients and leeches and stuff, but it's before evidence-based medicine, really. It's before, prescription drugs and, having to prove outcomes definitively before using them on patients. And so, I mean, the whole meaning I think the concept of healthcare as a right is kind of difficult to envision at that time period. So it's not just like the same struggle over a century-long period of time. And that really changes the context of who's fighting for and against it as well. The other thing that struck me was that there was some detailed explanation of the opposition to, most of this isn't even universal health care. It's like mandatory health insurance for employers. And it said, who was fighting back against that. But there's basically no mention of a grassroots movement or where the proponents of this law are coming from. It's just like a governor fighting for it, or it's a president fighting for it. So there's like a little bit of a great man theory of history going on here, where we're looking at like the powerful white men who are like fighting for these laws, and we don't see who's actually fighting for them. And maybe that's a combination of, maybe there wasn't much of a social movement behind, extending healthcare to everyone at the time, or maybe it's just missing from the history. But it's definitely something that we can't leave out for today. So, all right, anything concluding things, or should we wrap this up? And just, we're really interested to hear what you all thought about this first section of the reading. This is like setting up sort of the action that happens when the civil rights movement comes to the U.S. and when Canada starts passing at the provincial level universal health care. So, all right, you're up next.